Welcome to Age Fit MD with Dr. Zars, a no-nonsense age with power podcast. Flip your chronic injury script with Dr. Z.
Hey everybody, I'm Dr. Z. I'm the host of the Age Fit MD podcast. And if you've ever wondered, how does pain develop into chronic pain and how can I use that knowledge to my advantage to control it? Today's episode is going to be for you. Stay tuned, take a listen, and let's get started. So this is one of the most common questions I get from my patients is, how is it that my pain has gone from what used to be an intermittent problem to a constant, chronic, burning pain that often gets set off without me having to do anything at all to set it off? So let's step back and talk about how this occurs, okay? You've all heard of the term neuroplasticity. This is the concept that your central nervous system is designed to learn. It's designed to constantly change and improve on things that you want it to improve on and to not improve on things that you don't pay attention to. So this serves a very it serves a very big advantage to your survival in that think of for thousands of years, our survival depended on us learning things on an expert level. So let's say your ability to shoot a bow and arrow, to kill an animal to eat that day was dependent on you becoming really good at that activity. And imagine if every single day that you tried to do what you were starting at zero. So how does that process work? So any kind of neural transmission, let's use pain as an example, or any kind of motor activity or feeling activity, involves three neurons. It involves three separate nerves or three separate wires. So let's say I touch something with my finger. There's a transmission from my finger to my spinal cord. There's a connection called a synapse. Then there's a transmission to my midbrain, another connection, and then it splits off from there, goes to a part of the brain that identifies where it's at, part of my brain that goes to the emotional center, and there's processing in that. So let's say you're trying to learn something like shooting a bow and arrow or playing the piano. The more often you do it, the better you get. And there's three things that are occurring to make that happen. So anytime there's an impulse transmission where you do something repeatedly, there's three things that happen. The first thing is eventually it fires at a lower threshold. In other words, it might take a certain amount of effort to make that circuit fire. Initially, the more you practice, the easier it gets. It fires at that lower threshold. The next concept is it fires more intensely. So the slope of that transmission signal increases, gets more intense with practice. And the last thing that happens is it fires for longer. So in any given activity that you're firing repeatedly over and over and over again, it fires at a lower threshold, it fires more intensely, and fires for longer. So if you want to learn the piano or you want to shoot a bow and arrow, the more you do it, the more it happens automatically without you even thinking about it. And that's a good thing for our survival. Unfortunately, when you have a chronic injury or you've injured a nerve or you've had multiple surgeries, what happens is that pain signal undergoes those same things. So let's say you have a bad joint in your neck. Every time you turn to the right, you're signaling that pain signal, the fire. And eventually over time, with chronic uninterrupted signaling, it fires at a lower threshold, it fires more intensely, and it fires for longer. So you may have an arthritic joint in your neck that bothered you for years, but it really never was a problem. And all of a sudden, it just starts to take on a life of its own. The slightest activity sets it off. It's become super intense, it starts to burn, it feels like it's spreading, and that's the development of chronic pain. That's neuroplasticity gone wrong. So now let's reverse that situation. Let's say you want to get bad at shooting that bow and arrow, or you want to not be good at the piano. What do? You stop practicing, you stop that activity, you interrupt it. So that is a very important concept to understand about whatever injury you have that's developing chronic pain. Anything you can do to interrupt that signal, to practice less, to stop that repetitive, ongoing, day after day signaling will act to unwind some of those neuroplastic changes. It'll act to undo some of that and not make it so intense. So it's a key concept to pain management in keeping it from developing into chronic pain is early aggressive intervention. And that may be with aggressive physical therapy, it might be with some medications, or it might be with some of the remedies that I'm going to talk about on our next podcast that are very easy to use and can be very effective. One of them is a TENS unit. Another is some home massage things. A lot of people sort of blow these things off like, well, that's not going to fix it, so why bother with that? But what you're really doing is you're interrupting that signal, even if it's temporary, to keep it from becoming chronic and getting out of control. So think about the diabetic that has peripheral neuropathy and they feel like their feet are on fire. The reason is that pain threshold where it used to feel like it was burning at, say, 110 degrees Fahrenheit, now feels like it's burning at 98 degrees Fahrenheit. And now that it's firing at that level, now it's firing all the time. And the other two changes that occur are more intensely and for longer. So you can see how these things can get out of control if you don't understand what's happening and if you don't take measures to intervene. So I'll take myself as an example before we wrap up this discussion. I've got a chronic injury from a car accident in my right upper thoracic spine. I tore some of the ribs from the spine. I got some nerve damage afterwards. I was having a really bad pain day today. I was burning, it was searing, it was aching. And so what a lot of people might think is, well, I should probably take it easy. I should probably rest. And instead, in my mind, I thought, I gotta interrupt this. I gotta knock this thing down. I gotta stop this signaling somehow. So I hit the foam roller. I went in the hot tub. I iced myself down with some cold water. And then I did a really intense workout involving my upper back. I did lat pulls. I did posterior rear flies. I did some overhead dumbbell pullovers. I did some cobra lifts. I did some abs. I did stretching. And then I did cardio. And I feel awesome. The pain is gone. And the reason it's gone is because I've pushed my body, I've stretched it, I've interrupted those signals, I've distracted it, and now it's not hurting. So this is a key concept of understanding what your pain points are and what you can do to manage them, and being aggressive about intervening early and not letting it get out of control. So I hope you found this interesting and useful. It's a very useful concept to understand. In our next podcast, I'm going to go over some home remedies that you can do that are often overlooked, that can be extremely useful at interrupting that pain pathway, resetting the pain signal, and preventing your pain from going acute to chronic.
For more information about HFit MD, ImmuneX2, or Dr. Z's training, please visit drzars.com for a full line of supplements and educational tools to help you age with power.